Hi, my name is Gwen Dyson. I am the faculty and coordinator for the Medical Assisting Program here at Cape Cod Community College. Welcome to your online information session. So what does a medical assistant do? First, they do both administrative or office work. In addition, they also do clinical work. They work with patients. They do give shots. They do, in some settings, take blood. Wherever you work, it's a very fast-paced environment, and you help both your patients and the providers. What's really important is, when considering a medical assistant program, is that programs like ours are accredited. That really means a lot. That means that there's an outside governing body that takes a look at our curriculum, our lab supplies, our faculty, and they ensure that you're getting the education that you're paying for. Only graduates of an accredited program like ours are eligible to take the Certified Medical Assisting exam or the Registered Medical Assistant exam. They are the gold standards of certifications in our area, and all of our employers down here do require that you be certified. Another program that you graduate from, if they are not accredited, you cannot take these exams. In addition to being eligible to taking the gold standard for these exams, or being able to take the gold standard for exams, you also build up 29 college credits by attending the course at Cape Cod Community College. Those college credits are transferable. You can build on them. We've had students go on for nursing. We've had students go on for business. Whatever your interest turns out to be, you can build on the courses that you take here. The entire program costs about $7,000, and that's between the 3 semesters. The program is financially aid eligible for all financial aid that is out there because it is an accredited college level program. If you compare our costs with some of the costs of private programs can run $15,000 or more, and their courses are not transferable to any other college or any other program. So how does it work? You're going to be taking 3 semesters of part-time credits. You can start in the spring or you can start in the fall. Please make sure that you review the technical standards that are listed on our website. If you're going to be working in healthcare, there's a lot of physical and mental attributes that you want to make sure you're comfortable with before you decide to get into this very important profession. So what do you take your first semester? You're going to take Bio 105, Survey of A&P, and BIT 103, Medical Terminology. In order to be successful in applying for the medical assisting program, you do need to do well in both of these courses and attend an information session. This is your information session, so you're already partway there. I would also ask that you note here, if you're planning to continue into the nursing program, it's recommended that rather than Bio 105, that you take Anatomy and Physiology 1 and 2. In your second semester, you'll be taking HEA 134, Essential Skills for Healthcare, GIT 110, Microcomputer Applications, MAC 101, Medical Assisting Fundamentals, and PSY 101, Psychology. In your second semester, you'll be taking HEA 202, Pharmacology, MAC 204, Clinical and Practicum for Medical Assistant, which is 7 credits and includes an unpaid externship. We'll discuss that in detail in a few minutes. And finally, MAC 205, the Administrative Medical Assistant, where we go over all of the office skills that you will need. Please don't take the courses in a different order. because many of them are prereqs for the next course. So you want to start exactly as we've set it out here and then continue on. You do have to maintain a 75 or better in your courses to continue along with the medical assisting program. You need math. There's no getting around it. If you're going to be in healthcare, you need basic math. Medical assistants do learn how to do dosage calculations. Don't be afraid of it. It's really not that difficult. We also work with blood, with urine, with sputum, vomit, all different kinds of bodily fluids. So be sure that you're comfortable working with some of the less attractive aspects of healthcare. There is a required 160-hour unpaid externship in your final semester. It's required for graduation. We place you in an ambulatory care practice or clinic, and you work approximately 25 days in the final semester of the program. You do not get to choose where you go. We assign you. We assign you by where you live to try to make it as convenient as possible. Students should plan their work schedules and finances to accommodate this externship. It frequently leads to employment. Even if you're not placed in a specific practice that you're interested in, oftentimes the larger corporations, if they like you, will offer you a job and you can move over to the area of practice that you prefer. So again, you do not get to choose your externship site. In some areas, they're limited. So we try to get the site that's closest to you so that it's very convenient for you. You cannot use your employer as an externship site. Your employer and you have a very specific contractual relationship, and you're not allowed to work for your employer unpaid for 25 days. So we do have to place you somewhere else. All students in the Medical Assisting Certificate Program must pass a CORI and SORI every semester that they're in the program. You also must complete vaccination and health report requirements to continue in the program. Failure to do that will prevent you from completing the program or progressing from course to course. Students must be willing to get a flu shot. All of the sites require it now. There isn't any word on the COVID vaccination yet, but there may be. So if you decide that you want to go into this program, please be aware that you are required to take a flu shot and possibly a COVID-19 vaccine in the future. Some sites require additional reference checks or vaccinations. If you want to be placed in these sites, it may depend on your getting those additional requirements met. You cannot smoke cigarettes or marijuana at any time or place while in uniform. I have had students released from their externship because they came into the externship with the smell of cigarette smoke on their uniform, and the externship site has asked them to leave. I can't tell you how important it is. If you do smoke, I would strongly recommend that you cut down or make a commitment to yourself to not smoke while you're in uniform. All students must maintain a current American Heart Healthcare Provider CPR or better during their enrollment. CPR courses from Red Cross, CPR courses from the Coast Guard, CPR courses that are offered online, none of them are any good. It has to be American Heart. There is an excellent first aid and CPR course that is offered at 4Cs. It's taught by paramedics. It's a great course if you're interested in that. Otherwise, you may be able to get your CPR done at a local fire department for a somewhat reduced fee. So this is the information session that will serve as your information session. There are questions that you need to answer at the end of this information session so that we can confirm that you actually listened to it and that you attended. So what's next? You've decided, yeah, this sounds great. So let's talk about what you should do next. If you're a brand new student, you're going to apply to the college by filling out an application and submitting it to the admissions department, requesting that you be admitted to the medical assisting program. Please, even if you don't think you're going to qualify, fill out a FAFSA form and apply for financial aid. You never know. You can always say no if you're not interested in the future, but it may come in handy. And finally, you're going to schedule your college placement tests as required by the Commonwealth of Massachusetts. These college placement tests are just checking to see if you are ready to do college work. Every enrolling student, no matter who has not taken prior college level courses must take an exam both in math and English, high school level. Based on the results, a student might be asked to take developmental courses to help them reach college level. But each student can take the test twice, and the college has all kinds of information, workshops, helpful resources to help you get through these two very basic exams. They may be a little frightening, but again, they're high school level. If you haven't studied math or English for years, there are opportunities to review the material before taking the exam. You can go to a workshop and get it done. Please don't wait. You can't take any courses until you get these exams out of the way. So now you're an official student of Cape Cod Community College. You've taken your placement tests and you're ready to sign up. If you're a brand new student, you simply apply through the application process to the program. If you're a current student, you do need to fill out another application to apply for the medical assisting program. We can only accept a max of 24 students per year per semester. So please get your application in quickly. If you finish your 3 semesters in the fall, you'll have your externship in the fall. If you finish your 3 semesters in the spring, your externship is in the spring. With the pandemic, there's been a lot of concerns about our students finishing. So far, most offices are staying open and still accepting students in the externship. So now you've been accepted. If you're brand new to the college and you've gone to college before, make sure all of your transcripts are sent. They must be official transcripts. Please contact the registrar's office if you have questions on how that would proceed. You can ask for any previous courses that you've taken to be reviewed and see if they can be credited towards your new program. Keep in mind that any transferred courses must be similar in credits and content. If you're a current student and enrolled in another program, you can always ask one of the advisors who specialize in allied health. Medical assisting is projected to grow as a profession, something like 29% in the next 10 years. Again, you do both clinical and administrative work, which kind of makes it nice because every day is brand new, it's changed. The MEA program at 4 Cs is 3 semesters long, and you do have to maintain a 75 or better in your classes. And all of our graduates are required to sit for the certification exam. Not pass it on the first try necessarily, although something like 92% do, but you are required to sit for the exam. Otherwise, you may not be able to find employment. So again, here's my contact information, gdyson@capecod.edu. Currently, I'm not in the office, so it's really impossible to come to North 234 for a signature. You will only be worried about a change of advisor form, which I can do online, once you have finished your prereqs and are enrolling in MAC 101. Okay. Again, here is a chart with the courses. You don't need to worry about me being your advisor until you hit that MAC 101. Again, all students must maintain CPR, plan for the 160-hour or 25-day unpaid externship. Every Friday, we spend hours in the Nursing and Allied Health Lab. We use real supplies, we use mannequins, we use each other. We do have a lot of skills that we learned. Clinical instructors will be standing by watching you perform these tasks. These are currently still in person for some labs that we don't feel remote teaching is adequate. You will learn how to draw blood. You will learn how to do an EKG. So again, it's really important that you become certified. The only difference between the certifications is where the testing is done. And I think we've pretty much covered why these two, CMA or RMA, are the gold standard. If you don't pass for some reason, and some people are very nervous test takers, you can always take it again. We have a 99% pass rate. We report to our accrediting body every year how our graduates are doing. The enrolled students who graduate with that C or better is almost 91%. Graduate satisfaction the last 6 or 7 years has been 100%. Employer satisfaction, 97%. Job placement rate is 85%. And again, here is my contact information. Thank you so much for attending this online medical assisting information session. Best of luck to you, and I hope to hear from you. Thank you. Oh, and don't forget to answer those questions at the bottom.